Now here's an article from the New York Times, but to read it there, I will have to sign up. So I found it in the Star Ledger. No, the New York Ledger. Nurses have finally learned what they're worth. Let's see here. For at least 3 decades, hospitals across the United States have followed a model that aims to match nurses precisely to the number of occupied beds. It's a guessing game that has charged nurses performing daily tallies and hospital administrators anticipating the seasonal movements of illnesses and people, winter flus, and migrating retirees. Many hospitals don't offer nurses clear paths toward career advancement or pay increases. Depending on demand, they may trade nurses between units. When there are shortages throughout the hospital, they will send out emails and text messages asking nurses to come in and take an extra 12-hour shift. And when the shortages are too great, hospitals turn to travelers. Even before the pandemic, there were many reasons to hire travelers. Nurses would be brought in for a season, a maternity leave, or the opening of a new department. This kind of gig work grew increasingly common, and from 2009 to 2019, according to data from staffing industry analysts, revenue in the travel industry tripled, reflecting a workforce that was already in flux. There are hundreds of staffing agencies in the United States, national agencies, regional agencies, agencies that specialize in bringing in nurses from other countries, agencies that send American nurses abroad. In mid-March 2020, there were over 12,000 job opportunities for traveling nurses, more than twice the number in 2019. Then, as the coronavirus spread, demand came from every corner. By December 2020, there were more than 30,000 open positions for travelers, and with the help of federal dollars from the CARES Act Provider Relief Funds and the American Rescue Plan, their salaries started climbing. Job listings in Fargo, North Dakota advertised positions for $8,000 a week. In New York, travelers could make $10,000 or more. The average salary of a staff nurse in Texas is about $75,000. A traveler could make that in months. Nurses often refer to their jobs as a calling, a vocation that is not at its core about money. At the same time, nurses have spent years protesting their long hours and nurse-to-patient ratios. In 2018 alone, there were protests in California, Michigan, New York, Pennsylvania, and several other states. When the pandemic hit and travel positions opened up in hospitals all over the country, nurses suddenly had more options than ever. They could continue serving patients, continue working grueling hours in frantic conditions, but they would be paid well for it. Travelers were valued. Their work was in demand. The money would be enough that after a few weeks or months on the job, they could go home and recover. Hospital associations were already beginning to see the steep costs of these workers, but they had little choice in the matter. The shortages were too severe, and they would only get worse. In July 2020, Texas established a statewide emergency staffing system coordinated by select regional advisory councils. The state has put $7 billion in relief funds towards supplementing staffing, which has allowed hospitals like Northwest to attract travel nurses without shouldering the full cost. The problem is that their salaries were so much higher than our employee salaries, said Brian Weiss, the chief medical officer at Northwest. Our employed nurses were doing the same job, but they are saying, why are we getting paid a fraction of what these nurses are? The following year, the demand for travel nursing broke loose from COVID. In April and May 2021, as case counts dipped, hospital requests for travel nurses only grew exponentially. They now know what pent-up demand does to a healthcare system, and it's not healthy, said April Hansen, the group president at Aya Healthcare, one of the largest providers of travel nurses in the country. If you look at our demand today, it looks like our demand pre-COVID in terms of specialties, med-surg, telemetry, ICU, emergency room, surgical. It's just the volume that is being asked for in every specialty. It isn't the traveling nurse boom alone that has transformed the market. There are also more job opportunities beyond the bedside than ever. Nurse practitioners treat patients in doctors' offices. Insurance companies employ thousands of nurses. Microsoft and Amazon have hundreds of open nursing jobs. Today, only 54% of the country's registered nurses work in hospitals. There was competition for talent before the pandemic, Hansen said, but the pandemic took a small crack and made it as wide as the Grand Canyon. Well, that's interesting because the pandemic really opened up the eyes of people, or nurses, I would say, to see what's going on, because you have people who come in like from different states, like back in last year when I worked in a quarantine COVID hotel. Somebody was telling, and this wasn't like a nurse, this was like an aide, somebody employed to be on the floor. These were 12-hour shifts, and they brought them in. There were people like from Texas and other states, and one of the ladies was telling me that this lady from Texas was telling her sister down there, she got so many packages coming in from Amazon, and she was saying, don't open any of those packages, just leave them for me. She was making so much money. She was able to have enough money to buy a house, buy a car. And this is down in Texas. But the money she was making up here in New York, they brought these people in. And interestingly, some people were saying, well, why are you bringing these people in, like from Texas and other states, when you have people here in New York, who can do these jobs, but you're not hiring these people. Instead, you go to all these different states. So, but that's a different discussion in this topic. I found that interesting myself, that they're bringing so many people, and these were not like people with licenses. These were like CNAs and so forth, and they were paying them very good money, and all they really had to do was sit there like hall monitor, because you want to make sure, like one caught a man going into a lady's room. All the rooms, the doors were open, you see, so that presented a security risk. Because of the nature of the situation, none of the doors were locked. So they were all open, just in case you had to go in there, like in case of an emergency, you knock on the door. If you don't hear them, after a while, you go into the room to check, to see what's happening. And they call one guy leaving his room, going into a lady's room, So that was, so he was definitely, I believe he was arrested. You're not supposed to do that, and thrown out of the hotel. So she was doing her job. She happened to catch him going in there. But the hall monitors, they were paid very well. I mean, like maybe twice, 3 times what they would normally make if they were working in their home state. So not just the nurses alone. You got like people who are aides were making more money also. And then, of course, the travel nurses were making a lot more. And it's like, wow, how long is this going to last, It's like, now people realize, they're really being appreciated before. And I see in YouTube, some people make some videos, some nurses, showing what they were making before. One guy, I think, after taxes for the week, his pay was like $800 and something, from regular RN salary, I think med-surg or something. And then when he went traveling, it was like a few $1,000s for the week. A very big difference. So I guess it took a pandemic, something really major and drastic, to show what people really worth, which is really unfortunate.